You're listening to Drug Positive, the risk reduction and benefit enhancement podcast, reducing shame and stigma to save lives and end the drug war.
Drug users in Columbus and Whitehall will soon be able to test their drugs for fentanyl.
Health officials in both cities will soon start distributing those test strips, hoping to help avoid more deadly overdoses.
They might not always be ready for treatment, but that doesn't mean that they're ready to die. That doesn't mean that they're ready to die. 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 Ready to die.
Something is very wrong. More than 70,000 Americans died last year from drug overdoses. That's an unprecedented number of people. There has never before been a situation like this in our country, or anywhere in the world for that matter. The death rate is astounding, and the majority of these fatalities are a result of fentanyls, cheap synthetic opioids between 50 and hundreds of times more powerful than heroin. And make no mistake, fentanyls are poisons. They're being added to the drug supply, and they are killing our friends and our family members in record numbers. And in reality, this is not an overdose crisis. This is a poisoning crisis. We think of overdoses as if the drug user was pushing their limits, trying to get as high as possible because the drugs hijacked their brain. But that's just stigmatizing bullshit that lets politicians off the hook. People are dying because they're being poisoned. They're being poisoned by tiny specks of powder invisible to the naked eye being added to heroin, cocaine, and other drugs, and they kill within minutes. They're being poisoned by an unregulated criminal drug market, a direct result of prohibition, which turns the manufacture and distribution of drugs over to cartels. But this isn't what I'm most angry about today. What I'm angry about today is that the head of SAMHSA, the Substance Abuse and Mental Health Services Administration, the person who's supposed to be leading us out of this crisis, just published an article criticizing fentanyl testing strips, the only tool we have that allows people to detect fentanyl in their drugs before they consume them. Dr. Elinore McCance-Katz wants you to die. This is not hyperbole. Listen to what she writes. In criticizing the strips, she says, quote, "Our goal should not solely be to end deaths. It should be to facilitate the opportunity to recover, to safe, healthy, and productive lives." Do you get what she's saying? She's telling you that you need to recover if you're using drugs, that you are not healthy if you use drugs, that you are not productive if you use drugs, and that getting you to quit is more important than keeping you alive. Recover from what? Addiction? The vast majority of drug users have no problems with their drug use. They lead healthy, productive lives, and if you met one in a coffee shop, you wouldn't even know they used drugs. And guess what? The same holds true even for the majority of heroin users. People who use heroin are normal people. They work, they have families, they maintain their lives. Prohibition makes that difficult. We do our best to prevent them from holding it together, but most are able to nonetheless. The stereotype of the desperate, dope-sick heroin addict who'll do anything for a fix, self-destructive and sacrificing it all for the drug, is a small percentage of people who use heroin, and a small percentage of the people dying from fentanyl poisonings today. But listen more to Dr. McCance-Katz. She writes, quote, "The entire approach of fentanyl testing strips is based on the premise that a drug user poised to use a drug is making rational choices, is weighing pros and cons, and is thinking completely logically about his or her drug use. Based on my clinical experience, I know this could not be farther from the truth." Based on her clinical experience? Who's she talking about here? Maybe she's talking about the most severe cases of addiction because these are the people she probably sees in her clinical practice. But even these people don't deserve to die. Even these people need and want to know if there's fentanyl in their drugs. She even criticizes new data that has recently come out showing that over 85% of drug users will change their consumption behaviors if they learn their drugs are contaminated with fentanyl. She writes, "Although I know that there are self-reported data that may suggest otherwise, at the moment before they're about to use, again, based on my clinical experience, it is hard to imagine that drug users will not use the substance despite its apparent danger." This is the person, everyone, responsible for leading us out of the fentanyl crisis. And let me unpack this for you. First, she belittles the data by calling it self-reported. But what does that mean exactly? It means that social workers and researchers asked people what they did when they discovered fentanyl in their drugs by using the strips. This is a normal methodology in epidemiological studies used all the time. It's called interviewing people. But she implies with the phrase self-reported that it isn't valid. Then she talks about the moment before they're about to use. Do you see what she's doing here? She's conjuring a stereotype of the desperate addict in the throngs of withdrawal with no ability to rationalize and who will inject rat poison at that desperate moment if it contains even a little bit of heroin. This is total nonsense, people. Yes, obviously many high-dose opiate users in withdrawal become desperate and are more likely to take greater risks. But to use this as a reason to criticize fentanyl testing strips is delusional. It's disconnected from reality. We know that heroin users will change their behaviors when they discover fentanyls in their heroin. They may inject smaller amounts, space dosing out more. They may snort the drug instead of inject, leading to a slower rate of absorption. All these things can potentially save their life. They do not want to die. Even desperate users in the throngs of withdrawal do not want to die and have the capacity to alter their ingestion methods. Dr. McCance-Katz. But she doesn't care about that because, according to her, quote, "It's hard to imagine that drug users will not use the substance despite the apparent danger." Do you see what she's saying here? To her, it's either don't use at all or who cares if you die. Our goal should not solely be to end deaths. It should also be to facilitate the opportunity to recover. Our goal should not solely be to end deaths, but to facilitate recovery. People cannot recover, Dr. McCance-Katz, if they're dead. This is disgusting, everyone. The attitudes of the people supposedly leading our country's response to the fentanyl crisis is so morally judgmental of drug users that they won't support testing drugs beforehand for the poison that is killing so many people today. Every weekday, I pack and ship dozens of fentanyl testing strips to people all over the U.S. and Canada. This is part of my current work for DanceSafe. I manage the fentanyl test strip program. DanceSafe sells 10,000 fentanyl test strips a month, Dr. McCance-Katz. Guess to whom? That's right, to drug users, to heroin users. Most of the folks who buy our strips are in Ohio and the Midwest. A different demographic from the customers who buy our MDMA testing kits, who tend to live in big cities or on the East and West Coast. These are heroin users, and they're making their own efforts to protect themselves. 10,000 strips a month. If that's not enough evidence for you, Dr. McCance-Katz, that drug users are capable of making rational decisions about their health and safety, are capable of long-term planning, then nothing will convince you. But, I don't think facts will convince you, because your problem is prejudice. Your moralistic beliefs about people who use drugs, and your lack of empathy. Your emphasis on total abstinence from drugs reveals this. I won't say you lack compassion. I'm sure you feel sorry for drug users. You think we're all sick people who need help. In the same way North Korea thinks their citizens who try to defect need help. You're steeped in the new ideology that people who make the choice to use drugs must have had their brains hijacked, just like North Koreans who want a better life and don't support the supreme leader must somehow be brainwashed. Well, the road to hell is paved with good intentions. And so I won't say you lack compassion, but you certainly lack empathy, because empathy is understanding someone else. It's letting go of your own ideology and prejudice and figuring out what's going on with that other person. But you have no idea why people use drugs, why the majority of us use drugs. You've probably never asked a drug user why they use drugs, or the ones you have spoken to are already trapped in your system that threatens them with incarceration if they take any position other than the self-deprecating stance that they can't control themselves, that they're an addict. Like the Spanish Inquisition, you either believe what we say is wrong with you and stop using drugs completely right now, or you will suffer the consequences. I'm angry. I'm really angry. I've never been so angry. And, I apologize. Maybe I shouldn't come at it this way. Maybe she just literally has never spoken to a drug user outside of the incarceration treatment industrial complex. Maybe her prejudices are innocent. Maybe she just needs, like Scrooge, to be educated. Where is the ghost of Christmas past when we need him? So last night, after reading her article, I calmed myself down and I took the time to write Dr. McCance-Katz a letter. It's an open letter. It's published on the DanceSafe website, dancesafe.org. It's much more diplomatic than my rant here, but I stand by everything that I just said. The drug war is maintained by people who have prejudices or misunderstandings. They're steeped in a wrong-headed ideology of hijacked brains based on outdated animal studies from the 60s. And so she's conflicted. Of course she wants to save lives, but she also thinks the goal should be total abstinence and that nobody should use drugs at all. She thinks this is the ultimate goal, a drug-free world, and so she's got reservations about harm reduction and risk reduction programs, including the fentanyl strips. I get it, and I hope you do as well. And if you do, I want to ask you to tweet to her. Let her and her followers know that fentanyl testing strips are life-saving tools, that they're important, and that most drug users are normal people who care about their health and safety. Tweet her my open letter that's on the DanceSafe website, or just give her a friendly comment. Her Twitter handle is Dr. McCance-Katz. I'll spell it for you. DRMCCANCE_KATZ. One more time. DRMCCANCE_KATZ. Okay. Well, today we speak with a woman who's exactly the opposite of Dr. McCance-Katz. Her name is Helena Valente, and she's the Vice President of Kosmicare, a harm reduction organization in Portugal. They're the group that does drug checking at Boomfest, the largest transformational music festival in Europe. And because drugs are decriminalized in Portugal, they've been able to take drug checking to the next level. We discuss the work she does with Kosmicare, as well as what decriminalization has accomplished in Portugal. Remember, decriminalization means the possession of drugs for personal use is not a crime. It's not full legalization. It's still illegal to make or sell drugs. But eliminating penalties for personal consumption has done remarkable things in Portugal. They reduced overdose deaths by more than 50% just by decriminalizing drugs. They now have one of the lowest rates of heroin use in Europe, and meth is virtually unknown in the country. Listen to this interview. You're going to love it. Portugal has a model that all countries should be following, especially our own. Okay, but first, let's bring on Tatiana.
Hey, sweetie, are you okay?
I'm all right. Yeah. Got a little angry there, but I'm
angry too.
We should be angry. What did you think of that article she wrote?
I thought about that article when we were reading a psychology book last night in bed. And she was talking about this attitude that people can take on where they say, this is for your own good. You need to suffer in order to improve, or, we know better than you do.
Right.
We're going to make you jump through these hoops. We're going to make you do these unpleasant things that is unnecessary or stressful or whatever. This attitude of top down deciding what's good for someone else and not considering the reality of that person's life or listening to that person, listening to the people who really know, who are involved, who are drug users or who are working with drug users, who are on the streets participating in life with these people,
right,
and who know how these people's lives are affected by harm reduction efforts and that they work.
Right. Well, I'm spent in talking about Dr. McCance-Katz. I just encourage people to go to the Dance Safe website. We'll post the link to the letter I wrote to her. It was a very diplomatic letter. We'll put the link on the episode page.
Well, why don't you just briefly say who she is and what her organization is? She's a Trump appointee, right?
Yeah, I believe so. So the Substance Abuse and Mental Health Service Administration, SAMHSA, is within the Department of Health and Human Services, and it's supposed to be leading public health efforts around mental health issues. And, she runs it. She's called the assistant secretary, but she's the person that runs that organization. And what's so shocking to me really is that SAMHSA is not supposed to be the political agency in this regard, right? The DEA is, NIDA is definitely, they're supposed to be research, but they're definitely political. But SAMHSA is supposed to be about recovery, about helping drug users and reducing the impact of substance use disorders and other mental health disorders on society. They say here on their website, they were established in 1992 to make information, services, and research about substance use disorders and other mental health disorders more accessible to the public.
That's science. That's supposed to be science and data and information.
That's right.
And this crop of politicians doesn't know how to see science without a political lens.
Right.
If they don't like fact, they think they can disagree with it and impose their political perspective on reality. So we had another politician let us down, even worse, I think,
That's
because
right.
Jerry Brown supposedly is liberal.
What did he do?
He vetoed a bill that would have allowed a pilot program for San Francisco to create a safe injection site, overdose prevention site.
That's right. It would have been the first in the nation, and a lot of people put a lot of work, including the mayor of San Francisco, London Breed, who even got all the conservative organizations in the city to approve it. Not only the entire board of supervisors, but the local chamber of commerce was in favor of a safe injection facility in San Francisco.
They even went to the trouble of setting up a mock safe injection site just so people could see what it would look like. They put a lot of work into this.
Right.
And it went through all the hurdles, all of this coalition building. It gets to Governor Brown's desk, and he may as well had a poison pen that he's just jabbing into all these people. People are going to die because of his fucking poison pen that he used to veto.
Yeah, well, what this shows really is that the issue of drug policy is not a left-right issue. It's not a Democrat, Republican, or liberal conservative issue. You have smart conservatives and smart liberals who get it, and then you have the ignorant ones who don't. And Jerry Brown clearly is one of the ignorant ones who doesn't get it.
He doesn't get it because he's operating from belief. The word belief was included in statements from both these people. And that just really stuck with me because...
What did he say about belief?
He said, I don't believe that safe injection sites work. What they're saying is they don't believe that harm reduction works. And that's not looking at the data or the evidence or the experience of people in the field. That's just ignoring all that stuff and basing it on beliefs, which seems outrageous that people who are creating policy think it's justified. Beliefs are based upon a foundation of assumptions. And in order to change one of those assumptions, your entire belief system is threatened. So these people are stuck in this belief system, even though the facts are countering the assumptions that their beliefs are built on. Yeah. And so I'm thinking about this, like, how do you get someone to change an assumption when their belief, part of their worldview, is based on a foundation of that assumption? I think it must come to identity in the end, right? Because that's how most people get stuck in belief systems. They have a sense of identity.
That's exactly what I was going to say. I think that what's really going on here is a process of scapegoating. When Jerry Brown says, I don't believe that safe injection sites work, flying in the face of evidence collected decades and the fact that they have only worked tremendously well in the countries that have implemented them. What's really going on is that he's saying in his mind, we're talking about those druggies, those addicts, those people who aren't like me, right? Because everyone's got a degree of self-indulgence and self-criticism because of their consumption habits or whatever. And to make themselves feel better, they project what they don't like about themselves onto others. And for Jerry Brown to approve safe injection facilities, he would have to confront the fact that, well, we all overindulge. We all aren't perfect. We all engage in activities that may not be as healthy for us. And he's not able to do that.
Well, I think there must be a history that he's basing that it's worked for him and it's worked for these people to be in this pattern of stigmatizing and of considering the drug users to be other. It feels safe to them and they're stuck in that now.
Yeah, but London Breed, the San Francisco mayor, is not giving up. There's just a recent article with quotes from her that they're going to keep pushing for this. Because they know it works.
Of course they are. I mean, they've already created an incredible coalition.
Yeah, what's really interesting to me is that one of the ways in which all the folks working on this in San Francisco got the conservative community, the business community on board, is to point out that safe injection facilities move IV drug users off the streets and indoors. And that's something that everyone can support. Nobody wants to see people injecting drugs on the street. They don't want dirty needles on the street. Tourists don't want their kids to see people injecting drugs, right?
So I've had that experience. I remember one time I was in Golden Gate Park with my kid and we went to sit on a tree branch and there was a needle right there in the tree, where we were going to sit.
Nobody wants to see the public display of drug use. I mean, what are they going to have next? Crack pipe vending machines?
Just when you think you've heard it all, vending machines dispensing suspicious pens found on Long Island. The machines, they look just like the ones at the laundromat, but for $2 in quarters, you can buy these pens, which then can be used as a crack pipe.
Did you see anyone actually using it?
Yeah, I've seen a couple of people using it. Yeah.
Okay, so that's real.
It's a real thing, everyone. It took place on Long Island.
Yeah, no one can tell what's going on. Everyone in Long Island seems really confused about this audacious business venture.
What were these people thinking? It didn't last very long.
Yeah.
Well, we have a lot to say about this, but unfortunately, we don't have the time right now. But this is one of the stories we talk about in our Patreon subscriber podcast, Drug Nonsense. It's in the current episode, so head over to patreon.com, look up Drug Positive, and for a $3 subscription, you get access to all of our Drug Nonsense episodes.
We have some new subscribers.
That's right. We have 7 new ones, actually.
Oh, my goodness.
Maybe we should thank them personally.
Yes, thank them.
All right.
Thank you. Thank you.
So I'll just read off people's names. Charles, Christine, Gregory, Cohen, Nicholas, and Paul, our new subscribers at Patreon. Thank you so much. We love and appreciate you.
You guys rock. Thank you. So, talking about using drugs in public, it's not always bad. Sometimes it can be a great thing.
We did it just last weekend.
Yeah, we had just a wonderful date, an LSD date at a lake nearby. And it was just the sweetest afternoon. And it was really a wonderful break for us. Like when we take LSD, it gives our minds a break from the thoughts that we're obsessed with the rest of the time. And it lets us be in the moment and be together and just enjoy the day.
It was wonderful. We took what's called a museum dose. Sasha Shulgin and his crew came up with that term, which means sort of a low threshold dose where you can just feel it and your senses are enhanced, but you could go to a museum and if people saw you, they wouldn't know you were on drugs. And, I just want to say it was a late September day and we went into the water and I was holding you and being on LSD and just feeling your body. It felt like a teenager in love again. So it was a really special time.
That's so sweet.
Yeah.
It's making me cry.
No, it's true. You were so sexy, and Anne Shulgin also always said that she loves psychedelics that enhance erotic life. And LSD, for me, is certainly one of them.
Yeah, I agree. So, I just want to say how excited I am to find out that we have listeners all over the planet.
Oh, yeah, right.
I looked at that map the other day. There are listeners in every country in Europe.
Yeah,
I think the central part of the African continent is the only part that didn't have listeners.
Yeah, so we are syndicated through libsyn.com. That's where we upload our podcast and where the RSS feed is that iTunes, Google Play, Stitcher, and all the other services grab it from. And they have great statistics that show us where people are listening everywhere. And yeah, incredible.
Yeah, and we're going to include international material too today. We have an interview with someone from Portugal.
Yeah, that's right.
Let us know where you're, get in touch with us. Let us know where you're listening.
Yeah, and maybe we should finally release the phone number.
What's the phone number?
You can call, it's a voicemail line, we won't answer it, but you can call and leave a message for us at 530-DRUG guy. It's a Google Voice number. I was trying to find 530-DRUGGY, but that wasn't available. But I found DRUGGUY. That's 530-378-4489. If you have a comment, a criticism, a rant, a question, just call and leave it there. We'll love to listen to it, and we might just air it on the show.
Yeah. All right. So I want to invite you guys to follow my personal Instagram account where I'm not a super frequent poster, but I do little updates showing my artwork. I focus mostly on my art with my Instagram. It's called Imaginary Tatiana, all one word, all lowercase. Imaginary Tatiana.
She's an amazing artist, everyone. We also have a drug positive Instagram if you don't know about it, and a Facebook page and group. The drug positive discussion group on Facebook is not public. You have to ask to join. It's for people who listen to the show, talk about things on the episode. You're also free to ask questions, post comments there. That's kind of taken off right now.
And we have Drug Positive on Twitter. I've been tweeting out and would love any help connecting with new followers, retweets and...
Yeah, follow us on Twitter.
Yeah, get people, add us so that people know we're there because we're pretty new, so we have a small amount of followers. So let's get that number up. Okay, we actually have a segment this week. We have another People on Drugs. And I'm really excited to share this because I did all the editing and everything and had a fun time with it.
Yeah, it's a mini segment. And what it is a friend of ours who smoked DMT for the first time, which is always exciting to be a witness to. So here it is. We are in a canoe on acid.
Magic mushroom. MDMA.
She can't be flipped last night.
The spider.
Colors everywhere.
Life is wonderful.
People on drugs.
Keep the flame on.
Still a lot more.
Yeah.
Did you blow out?
Blow it out.
Exhale first?
Blow it out. Take another one, quick. Before you go away.
Whoa.
Hold it in. Okay, you're done. Hold it in. Bye.
I don't think he's broken through.
No. More? Wow.
You're still here.
One more hit. One more hit. One more hit. One more hit.
So much dancing. It's like my voice left me. Whoa. Oh man, that was insane. Wow.
I'm watching you, man. You have a smile on your face.
I've never wow, there's so much color and just as I was finishing that, I was just yeah. Oh.
Okay, what's the risk reduction tip this week?
Yeah, well, obviously, I think with this episode, the risk reduction tip should be test your drugs for fentanyl. Go to dancesafe.org and buy some fentanyl testing strips.
And share them with your friends, too. Let people know that fentanyl strips are available. I'm not even sure how many people really know that.
Buy them for any friends you know who are opiate or cocaine users especially.
Yeah, you could save your friend's life.
Okay, so... what did you think of the interview with Helena Valente?
It was so exciting. I'm so over the moon to hear about Portugal. It's such a positive story amidst all of this chaos here in the U.S. They're really doing things right over there.
What stuck out for you?
Well, so much. But one thing that was really interesting to me was connecting it in with socialized medicine. They have socialized medicine in Portugal, and she feels like that has created an attitude among the people in the country and the government where there's an incentive to do preventative measures, preventative health.
Yeah, that's right. Even conservatives can get on board with that because it saves money. You know, it's really ironic that conservatives in this country oppose socialized medicine, yet don't realize that the United States spends more per capita on healthcare than any country in the world.
That's because they're acting from their beliefs.
That's exactly right. Oh, wait, what else?
She also mentioned the medicalization of harm reduction, which is a super interesting concept to dig into because that's something that's always sort of at play within the harm reduction community.
Right. That's what, our whole show is about. If you listen to episode 0, our first episode, the Drug User Manifesto, we talk about this. We talk about the fact that harm reduction really began as a movement by and for drug users, right? Needle exchange volunteers were often IV drug users themselves, and they were trying to protect themselves and their peers. But harm reduction has also become a part of the professional public health community, and that's generally good. But it's important to maintain our roots as a peer-based community, and I think that's what Elena was talking about.
Well, part of what happens with policy decisions is that leaders want to rely on experts. And in this case, the community is really the expert. The harm reduction workers are the ones that know more about this. Right. And that people like Jerry Brown and McCance-Katz don't want to admit that drug users themselves are the experts.
That's right. This reminds me, too, of what we've talked about in previous episodes around using psychedelics for therapy. We've medicalized psychedelic therapy as well, when it may be the case that the social use of psychedelics amongst peers in public settings is even more therapeutic. These substances have been used medicinally for thousands of years by human beings, long before we separated mental health from community life and moved it into clinics.
Yeah, I really got to experience that firsthand recently with my accident because MDMA helped me to process immediately. I didn't end up developing a trauma response. People were asking me, "Oh, are you able to drive again yet?" and things like that. And I can totally see how someone would be filled with fear and go into panic, and those would even become entrenched thought patterns and that sort of thing. And I was able to interrupt that process right away.
Right. So this notion that these healing substances are best used in clinical settings, it may not be true. And similarly, harm reduction may be much more effective. I believe it is, of course. I founded DanSafe as a peer-based drug education and harm reduction nonprofit. It has to happen within the community.
It's preventative care for mental health, basically. It's mental health maintenance.
That's right.
So you and Elena had a great conversation, and she's great at expressing herself. What did you like about your interview?
Well, the first thing that stands out for me is that I don't do a lot of talking in this interview. She's really great, articulate, and had some amazing things to say. So she ends up talking like 4 or 5 times much more than I. And that's a little unusual because I'm a big talker.
Yeah, that's an accomplishment.
But what I really appreciated is that she brought up the importance of focusing on pleasure when doing harm reduction work. You're going to love this interview, everyone. I guess let's just get right into it. Here is Helena Valente from Portugal. Helena, thank you very much for being on the show. It's great to have you.
Thank you. Thank you for inviting me, Emmanuel. It's a great chance to be participating in Drug Positive. I listen to most of your shows, and I'm very flattered with the invitation and to be able to take part.
Oh, well, thank you very much. I have always been a big fan of Portugal and wanted to go to Boomfest for a number of years now, both just to have fun, but also to film for my documentary. Most listeners probably know that you guys decriminalized all drugs in 2001, and as a result of that, have been able to master the art of harm reduction, providing pill testing with high-pressure liquid chromatography, you were telling me?
Well, this was the first year we were able to offer this service. It was done by Kosmicare Association with a collaboration of the Spanish harm reduction team Energy Control.
Mm-hmm.
So this year, yes, we were able to do thin layer chromatography, but also HPLC, and offer the possibility of a really exact result and to quantify the substances to our clients at the drug checking service. So it was, in fact, a great opportunity. It didn't make total sense at this point in time because, in fact, one of the challenges that we had to deal with this year at Boom was particularly high-dose MDMA.
Right.
So, in fact, it would be the type of information that we would not be able to share without such good technique.
Yes, quantitative testing.
Yes.
So let's introduce you. You're the Vice President of Kosmicare. Why don't you tell people what is Kosmicare? How did it start, etc.?
Well, I will give you a brief history of Kosmicare intervention because Kosmicare begins at the Boom Festival, a large transformational festival. Maybe most of your listeners have heard about it, but it exists since 1997. And when the drug policy in Portugal changed, like you mentioned, in 2001, for the first time at the Liminal Village in Boom Festival, they hosted an information stand about drugs and about harm reduction. It was a very small thing with only harm reduction information, but it began in 2002 with a change of the law. Then in 2004, there was for the first time Cosmic Kiva, which was a psychedelic emergency service that was promoted by MAPS at the time at the Boom Festival.
Mm-hmm.
And in 2006, for the first time, we performed drug checking using colorimetric reagents. At the time, it was also the only technique that we had available.
Right.
And then things evolved. In 2010, Kosmicare was a project within the Boom, but it already had a partnership with the university, with the Catholic University, and also with the Portuguese government. So it was already quite a big project, but it mainly focused on psychedelic harm reduction and on crisis situations. And a separated NGO was doing drug checking. And then in 2016, we officially created the Kosmicare Association. So now what we offer at Boom is like a full spectrum harm reduction from all the information material, all the harm reduction paraphernalia, a place where people can rest, the drug checking service, and also we offered psychedelic crisis emergency for people that are underwent any type of difficult psychological situation that may be due to drug use or not.
Right. So you're like Dance Safe and Zendo combined.
Yeah, a little bit like that.
And do you do other events besides Boomfest?
We began with Boom, and we are now already in a moment where we are negotiating with other festivals to expand our services.
Mm-hmm.
And our goal would be also to provide a more permanent response to people. So we actually will be soon crowdfunding for the possibility of opening a drop-in where people can come regularly to test their drugs and also to look for harm reduction counseling and advice on a more regular basis.
Oh, great.
We're doing a lot of research with our project. We've collected many data with Kosmicare throughout the years, and we've already have some evidence that this type of services, particularly the drug checking, do have an impact on people's behavior. It makes sense to offer this to people on a more permanent basis because a lot of people do drugs at home and they do drugs in many situations, not only in festivals.
Right.
Particularly since Portugal, as you said, has such a particular framework. We're one of the few countries that have a framework to accommodate drug checking. What we do is legal. We do it with a permit from the government. So it really makes sense to have this experience here and to understand the impact that can have.
That's great. You know, in the United States, we have a law called the RAVE Act, which can hold festival promoters and club owners legally liable if their customers are using drugs. So many of them have been afraid to allow Dance Safe to come in and do drug checking. So that's a big hurdle here. And because of that, I've been a strong advocate for Dance Safe and others to open up drug testing centers. And I know there are many local governments that are very supportive of that. So once again, Portugal may end up being a model for that. I hope you can get that off the ground.
Well, us too, I think, because it's also that we are able to produce some type of evidence that can help others in terms of advocate for more comprehensive drug policies.
Right. So what are you seeing? I mean, to me, it's just obvious if you arm a drug user with more information, that's going to improve the situation. But you said you're collecting evidence to prove to skeptics, I guess, that it really actually does improve things. What are you finding?
Well, we've done a case study, which I think is interesting, about the detection and the prevention of the unintentional consumption of DOs and of N-bombs at the Boom Festival.
Right.
That particular year, we started detecting a lot of adulteration on LSD.
And though you mean DOB, DOC?
DOB, DOC, yeah.
Yeah. Now, other than tripping harder for a much longer period of time, are you seeing fatalities with those or just the N-bombs?
Fortunately, we didn't have any fatality at the festival related with these two substances, but we had an enormous increase of crisis situation, of people going to the Kosmicare psychedelic crisis due to what they believed was the use of LSD.
Mm-hmm. Right.
And we started detecting at the second day of the festival more than 50% of the samples that were expected by users to be LSD were something else.
Right.
And this was, in 2014, was like a novelty to us because LSD, until a certain point in time, didn't have a lot of potential to be adulterated, particularly because it was in micrograms.
Right.
And with all these new psychoactive substances, the market really changed. And we saw this. And in this year, we had a very interesting thing. We decided to publish an alert about these adulterations. And the first thing that we see was that in the next day, the number of intended LSD samples that we tested actually doubled, seeing that people saw the alert and they cared. They really wanted to come and see what was in their blotters. And then in 2016, we did again this type of study, but for all of the drugs. And in terms of reported behavioral intention of our users, when the substance was not what people expected, over 98% said they would not take it. And it was a statistically significant difference.
Yeah. Is that surprising to you?
Not at all. Not at all.
So who are you trying to convince? Were there skeptics in the government who just didn't believe that would be the case?
They're skeptics. Actually, this is still not evidence, what people would call the golden standard of evaluation. And that's what we're pursuing now.
Wait, hold on. 98% of the people who found it wasn't what they were expecting didn't want to take it. How can you get a gold standard better than that?
No, what I mean, it's not the gold standard in the sense that you're asking people, it's their reported intention once they get the result, but you're not absolutely sure that that's what they're going to do.
Oh, I see.
So now in 2018, we implemented a quasi-experimental study and we collected information with our drug checking clients in 3 different moments: when they come to deliver their sample, once they come to get the result and get their counseling, and then in a third moment, I ask them to come back and actually tell me what they did. And I also did this for a control group, for people that used the drug info service but did not test their drugs.
Interesting.
And now I'm analyzing these results. Also, it was quite a long questionnaire. People were extremely kind to participate. And I think this also says a lot about people that use drugs, because often they are perceived as people who don't care about their health or who don't care about what they're taking. And here you not only see people that really want to test their drugs, but they're also willing to help drug policy in the sense that they come 3 times to a place just to tell me something because they know it might be important to research and to really provide evidence that this type of services works. So this is how thankful people are.
Great. I'm so glad to hear that. And, that's also true with opiate users as well as party drug users. Most drug users are normal people. They're good people. They don't want to die. They want to help their community. It's we who are stigmatizing them that we need to stop doing that.
Absolutely.
Mm-hmm.
Absolutely.
So how many of these people went back to their dealer and tried to get their money back and told the dealer, hey, you're selling bunk stuff, you should stop doing this?
To be honest with you, this year, we actually had an extremely good year in the sense that we really didn't struggle with much adulteration this year. The main problem that we had was in fact high dosage pills.
Uh-huh. Now, could that be that everyone knows that Kosmicare is going to be there and the people who are dealing bunk drugs said, well, I'm not going to be able to get away with it this year. And so just your presence is adding quality control to the market?
Well, I think in fact, the results that we find at the boom sort of follow a few of the results that you find in Europe. But there is evidence. There's actually 2 different studies that have seen that drug checking does influence the market and that the composition of illicit drugs seems to correspond more closely to what is expected in countries that do have drug checking system than in countries that do not. There's already some studies suggesting that there is an influence of the drug checking services in the illicit drug market. So I may assume that in boom, the same can happen because people can test.
We saw that in the late 90s when DanceSafe spread very quickly in 1999, and we got rid of the dextromethorphan pills that were flooding the market. Just our presence ended up stopping people from selling those pills. But let me blow your mind here for a minute. You probably aren't aware of this, and my guess is that you don't have very many people in Portugal with this perspective. But
we're not such a paradise. But
well, let me see. Let me see if this blows your mind. In my country, the government measures their success in how adulterated the drug market is. The 2 things that they use to assess successful drug prevention is, number 1, is the risk perception among young people high? And the higher that percentage is, the better they think they're doing. But the second one is the purity of the drug market. The more impure the cocaine market or the ecstasy market is, the better they think we're doing. In other words, we have people in this country that want to see people dying. Because when people are dying, it sends the message that these drugs are risky and fewer people will use it. Do you have anything like that in Portugal, people like that?
Well, you obviously have people that have questioned this drug policy, and obviously you have still a lot of morals surrounding drugs, but not at the same level. And the thing is, the evidence is that, for example, when you see those big studies on children, school children and teenagers, they compare the different European countries in terms of data, and the Portuguese situation, although we do have this, we could say still it is a prohibitionist policy, but it's less prohibitionist than in other countries, and you could say more permissive. But in fact, Portugal is still below all European level in all illegal drugs in terms of prevalence and use. And also when you have our teenage and our children answering to those types of questions about the risk perception, the Portuguese seem to have a higher risk perception of certain drugs than the rest of some European countries. So actually, in that sense, a more permissive drug policy, and this is what evidence shows, does not give you the idea that drugs are safe and people just don't start doing drugs randomly. It's not because you have less adulterated substances or because your drug policy is not so prohibitionist that your risk perception is going to be low. And that you're going to think, oh, it's okay, since the government says that it's not a crime to use drugs, maybe it's because drugs are safe. No, actually, people in Portugal do have a high risk perception.
And you think, is that just culturally? You think that's just the culture of Portugal?
No, I just think that the drug policy also gave you the opportunity to have a fair debate around the issue of drug use, and it gave you the opportunity also to reach a lot of people talking about this. And when you see, for example, the use of heroin has been decreasing in Portugal, and when you look at the statistics, when you look at the age between 15 and I believe 34 years old, the prevalence for heroin use is like 0.
So you're saying it's not even neutral, it's that the liberal drug policies of Portugal, by opening up the public conversation, is actually decreasing overall drug use and increasing risk perception, because we can now have an honest debate and know that the risks are true.
I think that the biggest impact, drug use has been decreasing. We can't directly say it is because of the law. It has been decreasing for certain substances. It has only been increasing for cannabis. But the thing is, you can talk about it more open, and you have a lot of other benefits that came from the change in policy, but not only. I think what Portugal did right was it did create a better legal framework that does not punish, it still punishes drug trafficking, but it tried not to punish drug users. But at the same time, it created a really wide range of responses to people that needed them.
Right. Decriminalization, which is what you did in Portugal, where possession for personal use is no longer a crime. It opens up the public conversation, and it opens up public services for drug users.
That I think that was what really was the game changer, was the fact that a lot of people start reaching the services, and that was due to the change of the law. There was a decrease in HIV and tuberculosis and HCV and drug-related deaths, everything. And this is evident, not to mention that obviously we have a lot of less people in jail, particularly people that use drugs, but that only did like very small crimes or something like that because of drug use. So it didn't make any sense. And that's very evident.
Right. Now, do you personally remember time before 2001, before decriminalization in Portugal?
I didn't work at the time in the drug area, but I remember that in the 90s there was a heroin epidemic, you could call it like that, in Portugal. And I remember because many families, in every family, I think you could almost say in every family, there was at least someone with a problematic heroin use. And there were tons of people doing drugs open air, and there were many overdoses. And actually, I believe that what motivated the change in policy was that for a certain point in time, drug use was and particularly problematic drug use was confined to only certain groups of people, and many times vulnerable and poor people. And so it wasn't such an issue. But once it became more transversal and it reached a lot of middle-class kids and a lot of high-class kids, then everyone started thinking, well, this is my nephew, this is my niece, this is my son, my daughter. It seems that almost every family somehow was affected. And this was what I think made people think, oh, we have to do something about it.
Right.
So if it was only for the more vulnerable users, to be honest, I don't believe that the drug policy would have changed like it did. But because it became such a pervasive problem to all society, people started thinking, no, definitely, this is not working and we need to do something else.
That's what's happening here now in the U.S. with the opiate crisis. It's breaking out of perceived marginalized communities and entering the mainstream. We had 70,000 overdose deaths last year, and we're seeing a lot of organizing, a lot of movement around naloxone, safe injection facilities. Unfortunately, just this morning, Jerry Brown, the governor of California, vetoed safe injection sites in the state. So that's a big setback. But still, on the local level, lots of organizing around it. And I think it's for the same reason. Enough people are being impacted by these drug policies that people are looking for alternatives.
That's when you start, mobilizing people. But as I told you, not everything here is perfect because we still don't have a safe injection site in Portugal working. We're still trying to struggle for that. And I think we might have in Lisbon soon 1 or 2 safe consumption rooms opening, but we still haven't managed that. So although that's all in the law, a lot of the things didn't get out of the paper. We don't have distribution of naloxone either. So there's still a lot that we can do.
So tell me, how do young people talk about drugs in Portugal? How do you think the party drug culture in Portugal differs from countries that don't have decriminalization? Do you think the openness has changed the way young people talk about drugs?
Well, I think Portugal follows a trend that happens in other countries where drugs somehow have become a normalized part of a lot of young people's life, and that has its positive things, but it also sort of became a commodity for some groups of people. And that's also an issue.
What do you mean by that? Becoming a commodity?
In the sense that it's part of an experience or a night out and you do drugs and it's something that you have incorporated in your leisure time as something else that you buy. You also buy drugs and you also take drugs. It really depends on the scene that you're going, but I think this happens. But it also depends on which drugs you're talking about. For example, as I was telling you, cannabis, I would say that it is very, very normalized for a young person to smoke cannabis, and it's part of probably of their daily life and their daily routine.
What about other drugs? What about other psychedelics?
In terms of psychedelics, I think you have a few, how would I call it? A few spaces where psychedelic use is done, but the rate of drug use in Portugal in general is quite low. You would say it's quite low. Even ecstasy, it's very low if you compare it to Spain, particularly.
That's very interesting. The country with the most liberal, most progressive drug policies has one of the lowest rates of drug use.
The other day we were discussing that. But yeah, we have compared with other European countries. And if we look here at Spain, at substances, for example, like cocaine or anything, our rates of use are quite low. Obviously, in party settings, people use more drugs than the general population. But there's very low prevalences of drug use in Portugal.
Yeah. I've always thought there's a direct relationship between how anti-drug a country is culturally and the amount of drug abuse they have. But it's backwards in the way you might think. Because if you look at the data coming out of the UK, where they have the highest rate of MDMA fatalities, where the Global Drug Survey discovered that they use the most MDMA per session than any other country in the world. And they also have the most anti-drug media I've ever seen. The culture there is so anti-drugs. The Protestant, anti-pleasure attitudes that people have caused young people to rebel in the opposite direction. And they see drug use as a hedonistic activity, and therefore they don't moderate. They don't perceive a responsible way to use drugs.
Yeah, I think it's a bit like this. I wouldn't say that, for example, here the use of drugs is perceived as a lot of countercultural thing anymore, because it's not that people use it that much, but it's not very frowned upon socially. Obviously, you have more conservative parties and you have more conservative sides of society. And I think we could have evolved a lot more in these past years, considering that we changed the law already in 2001. I think that in these last years, we sort of said, oh, we were so successful, let's just leave it at this because it's working and there's no need to do anything else. Let's just stay like this because it's working. And I think obviously there's still a lot of work to be done. But in fact, I think the law had this impact. And in terms of fatalities, for example, in festivals, or like you were mentioning in the UK, you can do a lot of prevention. You can prevent a lot of fatalities by working on the environment and working on the context. And for example, that's something that it's also being done a lot at the Boom, because if you make water available for everyone, if you make sure there's shade available for everyone, that you don't have police that will be on site arresting people, for example, then I can actually send you a few pictures of our drug checking service. People are in line and it's a huge line and they know that they can safely be there. There is police on site, but they are aware that they can safely be there to test their drugs, to ask for information. They can sit down with us, have a counseling moment without fear of being prosecuted or arrested or anything. For example, we have so many people participating in our research and we want to do a follow-up. So we actually sometimes ask for people's emails and everything, and they are quite open to participate because they are in this particular framework where they know that the fact that they might admit that they use drugs it's not gonna put them in jail. And so the festival, that you don't have sniffer dogs, so you don't have to do this preloading.
Right. Along those same lines, there are many people who email DanceSafe saying, hey, do you have a local place where I can buy a testing kit because I don't want to put my credit card into the online system. They're afraid to purchase a testing kit and then somehow be targeted as a drug user.
That's the thing. For example, here, there's a lot of things I think that create an environment where people can actually do drugs in a much safer way without always feeling the pressure of being arrested or being prosecuted. For example, new psychoactive substances. You don't have people in Portugal saying, oh no, I'd like to use synthetic cannabinoids, because, well, they can get the more classic substances. They know they can get them at a fair price, and they know they are probably safer because we've been studying them for a long time and we know almost nothing about these new substances.
Absolutely. One of the main reasons people use K2 or spice in this country is because it doesn't show up on drug tests, and they're afraid to use cannabis, which I wouldn't even say is much safer. It's completely safe. So these deaths are directly caused by prohibition.
Obviously.
It's so obvious. How do we get people to understand that? I mean, I'm going to air this interview and people are going to hear it, but lots of people have been saying it over and over again. When you liberalize drug laws, you reduce drug-related fatalities without increasing drug use. How do we convince people of that?
Well, I think what happened here is what I told you. Once it was a problem that affected everyone and not only more vulnerable users. But the thing is also that incarceration can be quite expensive. And here prevention can be much cheaper than the money you spend in hospitals or in prisons. The thing is, we have a social security and we have a national health system that pays. It's for everyone. We don't have health insurances. We have a free access to health and national hospital. And the thing is, for example, a lot of people having problems with drugs, if they really have a lot of damage from their drug use or overdoses or people dying or going to the hospital, this would cost money actually to everyone. So once you start putting money in prevention instead of damage control, when you have less people doing HIV medication or other types of things, then it's better for everyone. It's better for the state and it's better for all the Portuguese, because we're all paying for that type of treatment. Right. So this economic argument also makes sense because, for example, prisons are public. Every citizen pays for
I was just going to say that, we have a private prison industry in this country that lobbies to keep incarceration rates high. Yeah, I think you hit the nail on the head there.
When we think about it, I think that makes a big difference, because over here, what's been happening is that when you talk to general public about the economic part of it, people say, oh no, it really makes sense. It's much cheaper to offer drug checking than to deal with a lot of other issues. But when you have a private sector in health or in prisons, then I imagine that makes it harder to advocate for that, because there's a lot of people earning money with
but you did give me an idea. Health insurance companies ought to be in favor of prevention because they typically have to fork out the costs when someone goes to treatment. So, they should get more involved in promoting harm reduction.
Probably.
Yeah.
Still, it doesn't mean that everything here is perfect and that everyone supports harm reduction. We advocate for what we need to advocate. Sometimes we lay low when we need to. For example, every year before the boom, a few days before the festival, there's always one or two media articles in a tabloid speaking a little about, they're offering tests to see the quality of drugs and telling people, all that type of
enabling drug use.
Yeah, enabling drug use and that type of thing. But it's very rare to see that argument. I think over here people have really understand because they watch the difference. You had a lot of open air, people using drugs on open air sites, a lot of needles and sometimes in the beach. And for years, all of that disappears. So I think for the common citizen, that is very evident. You had a lot of petty criminality, a lot of people asking for money on the streets, a lot of people using drugs, and that sort of disappeared in a sense. So I think everyone sees the benefits of the change in the law, even if they don't really realize that the law have changed. Probably not all Portuguese people know that, but I think that it's clear the benefits. There's still a way to go, I think, obviously. Mm-hmm. But still, I think for everyone, it's obvious that a more comprehensive legal framework allows you to do a better work, and that's undeniable.
How did you get involved in this issue?
How did I get involved in this issue? Well, I'm a psychologist.
Mm-hmm.
And it was in two different ways, actually. When I was at university doing my degree, I wanted to start doing something and have some type of experience. And I started to volunteer in an outreach team that did methadone and needle exchange. And that was in 2004. So that was one of my first contacts with harm reduction, and that was when someone actually taught me what harm reduction meant and what was the methodological and the framework behind harm reduction and what harm reduction meant. And I thought, wow, this is really interesting. And at the same time, at the time I was going out and going to parties, and this NGO where I volunteered also wanted to do something in party settings. Then they had a few volunteers and they thought, oh, maybe you would be interested in participating in this. And I thought for me, it made more sense because I could actually be more of a peer in a project like that.
Right.
Party settings. And then I started and it was like that.
So had you used psychedelics, MDMA, party drugs when you...
Yes, I have.
Yeah. So you were part of the community, and were you aware of drug checking before this program suggested doing it?
Not at all. No, before I entered that NGO, no, I was not aware that such a thing existed. Then I actually met my husband in this team, and he's a chemist, and he's responsible for the drug checking. So we sort of incorporated this in our life.
So now you always test your ecstasy before you take it, right?
Yes, absolutely. He is very, very, very serious on that. He wouldn't allow me ever to take something that was not tested. Yeah, he always tests everything that we take.
Great.
Well, we have a kid, and so we want to make sure that we do things as responsible as...
Yeah, right. How old is he or she?
He's 3 years old. He's a he.
Oh, great.
So we are very aware of adulteration and the harms it can cause. So yeah, we always test, we always measure.
Keep yourself alive for your child's sake, if not
definitely.
your own, right?
We try very hard to implement the harm reduction that we preach.
So, that brings up a good question. What is drug education like, and what age does it begin in schooling in Portugal?
I know they mention the different types of drugs, I think probably in 4th grade.
4th grade?
Yeah, they mention it. They mention the existence of different drugs, but I think it's very brief. But in schools, I think what they offer, it's pretty much trying to give people sort of alternative activities so they don't engage in problematic drug use. We also have been approached. We don't do many prevention, but we have been approached to do like a harm reduction consultation, because the thing is, there's very few responses, if any, to people that actually do use drugs, particularly young people that have started already with their drug use, and they want to know how to manage it better.
They might actually get harm reduction into high schools in Portugal.
To high schools, yeah. And we've done a few attempts, but it has to be carefully done, obviously, particularly when people are underage and you're acknowledging their drug use. But we've done it. We've done it before, but not on a regular basis. And I think if you want to really work things, it has to be more regular. But we've been invited for a few sessions to talk to students. And usually the results are very, very interesting. And you can do really interesting things with people, particularly when they're just beginning sort of their drug use. But what we're seeing, for example, with the drug checking is that you actually reach a lot of people that you wouldn't reach otherwise. People that would not come to any other conventional service when they have doubts, but they do come to the drug checking.
Yeah, this is what I realized when I started Dance Safe back in 1999. I had been a volunteer for many years with an organization called Food Not Bombs, which advocated for homeless rights, but also provided free meals. And through the direct service, they were able to organize the homeless population to become active in the political movement for changing laws to eradicate homelessness, etc. And I realized that if we just went out with a table and literature and tried to organize homeless people to become politically active, it wouldn't have gotten very far. But if you provide a direct service, you immediately win the trust of the people and they start to get involved more deeply. And when I learned that there was a chemical reagent that could help ecstasy users identify the counterfeit pills, I started DanceSafe because it matched the Food Not Bombs model, and a light bulb went off in my head, and I said, wow, this is a way to organize a broad-based movement, and well, it worked.
Absolutely, it did. And that's the thing, for example, even if when you're talking about reagent testing, even if you only have reagent testing, it's already like a really good opportunity to open a channel of communication with someone, to just talk about adulteration and talk to people. And the thing is, when you have a non-moralistic approach to their drug use and you give them quite good information about what they're taking, sometimes they say, they are so surprised and they say, wow, thank you for doing that. That when they come and you say, look, we've detected this adulterant, this is very dangerous, or we were unable to detect what's in your sample, so I would advise you to be extremely careful or probably not take it. People say, yeah, I'm going to listen to what they are saying because I know that if they're telling me that I should be really careful or I should not take it, they're not being moralistic about it, but they probably really are concerned. And when you sort of build this reputation around the services that you provide, then people tend to really believe you, and that makes a difference. You have this relationship built on trust and not on judgment, and that I think makes a lot of difference.
Right. So when is the next Boomfest?
Well, in 2 years, and you should definitely come.
I will try.
Be happy to have you if you want to start engaging in conversations right now. And
yeah, let's do it. I'll volunteer with Kosmicare.
Well, we'll be happy to have you.
Great.
I believe my colleagues allow me to already make you a formal invitation.
Oh, great. Thank you.
In 2020.
2020, June, is it?
No, it will probably be, usually it is in August in the full moon, but this year it was a little bit earlier in July because Portugal has had a lot of problem with fires and with the heat, and so they thought it was safer to do it a little bit earlier. So it will always be July or August.
Okay, great. Well, I look forward to that. Make every effort to go. All right, anything else you want to say? Anything you feel it's important that we forgot? Final message you want to leave people with?
Well, I believe that what we can learn from the Portuguese situation, and that hopefully I was able to transmit that, is that if people do use drugs and they will keep on using them, so the best way to approach this is using the evidence that we have available, and we already have a lot of evidence showing us that comprehensive health services will help people do a better management of their drugs. So I think that makes sense to provide them with that. And also what we've been discussing among ourselves now is also that harm reduction should really also rethink its standpoint, because we should maybe not be focusing only on harms, but particularly on pleasure.
Fantastic. Yeah. I'm so glad you brought this up. I say this all the time. Keep going. Tell me why.
Well, I've been thinking about this a lot because, first of all, you see, in the beginning, the harm reduction movement was a very bottom-up movement, and it was, in a sense, counter the more hegemonic speech about drugs. But once you start just focusing on harm and focusing on a health imperative, it can be dangerous on a way, because you can sort of giving the idea to people that you're giving them all the opportunities to change their behavior, and if they don't behave well and they have problems, it's their fault.
Mm-hmm.
And I think we sort of should also look at the more structural situations for why people use drugs, because when you ask people, we did this in our research, why do they use drugs? Many people use drugs for fun and
go figure.
Yeah, so I believe it is undeniable that drugs do have benefits, and I think
Right.
that harm reduction needs to also incorporate this in its approach, and maybe try to incorporate a speech of pleasure in our harm reduction discourse, because I believe a lot of people that we could sort of gather around the harm reduction movement don't come because might think that harm reduction can be a little bit self-righteous at times. So, yeah, I would call it probably pleasure enhancement. I think you also use that term.
Yeah, well, this podcast I called the Risk Reduction and Benefit Enhancement podcast.
Yeah, I think that's a great definition. And I think that's something we try to incorporate more and more, particularly when we're training peers and volunteers to work with us. We always say that it's really important not to have a moral stand on people. And more importantly, we should try to think when we're giving some type of harm reduction strategy, what's the risk, but also what's the benefit people can say. Particularly young people, they might be a lot more receptive to something that you tell them if that's going to mean that they're going to have more pleasure than if you speak about a risk that they don't perceive as something immediate. So even in terms of the impact of the intervention, I think pleasure is fundamental.
Right.
And we have to incorporate it. And the medicalization of harm reduction that at least in Portugal, it was something that happened quite a lot because harm reduction had a lot of success. It was sort of institutionalized. So now I think the peers are again trying to take back their legitimate space. And I think that's an important discussion to take. And we should be aware, I think you guys in the United States are very aware of this, but also in Europe and on these platforms like Facebook and YouTube and everything, that we're having a lot of the harm reduction platforms being banned or being censored. And I think we really have to keep an eye for these new times that are approaching. And to make sure that we're very aware of
Yeah,
this.
just trying to advertise on Facebook. I mean, that's one thing. They're restricting the reach of NGOs to force you to pay money in order to advertise. But when it comes to harm reduction, Facebook has removed all of the drug-related keywords. You can't target your message anymore to people who have liked LSD or MDMA or drugs. So there's no way to find those people now. And I don't think they thought about the negative impact this was going to have on harm reduction NGOs.
This is something that I think we really have to be aware now and to be careful. So these are actually the concerns that we as a group in Kosmicare are trying to deal with.
Well, thank you very much, Elena, for coming on the show. It's been great. I hope thousands of people listen to this.
Well, let's hope, yes. And if you're listening, you can all look for Kosmicare on Facebook or in kosmicare.org. That we're already building our website. So thank you, Emmanuel, for having me. It was a pleasure.
Great. And that's Kosmicare with a K at the beginning.
Yes.
Awesome. Thanks again, Elena.